Hi, I'm Paul Haas. I'm the fire chief for City of Dover Fire and Rescue, and also my role is the emergency management director for the City of Dover, which has me responsible for preparation and enactment of our emergency plans for any large-scale emergency, pandemic like we're experiencing right now, a weather event, or just unexpected event that really interferes with the city's operations and those of our citizens in general. I just wanted to really start a conversation by recognizing the citizens in our community and essentially thanking them for the support that they've given us, literally through donations in some instances of PPE that they may have had around the house for whatever reason. I mean, as most people are aware, some of these things that are so critical now, most commonly the N95 mask or even the simple surgical masks, are things that prior to a month ago were very common in some people's houses for painting or sheetrocking or carpentry or whatever, and certainly for contractors would use a lot of those things, and they're now seeing the need that we have for those things on a daily basis to keep us safe. And we're seeing a lot of folks make contributions, calling to see if there's any way that they can make those donations to us. We've had monetary donations from citizens specifically to allow us to buy some of this extra personal protective equipment, this PPE that we were not anticipating the level that we've needed. So yeah, I really just wanted to recognize that those people are out there and they're not just looking out for themselves. People are really keeping an eye out for us, which we appreciate because that's typically what we view our role to be, is us looking out for them. But it's been something that's notable, and I wanted to bring it up because it really does speak well for our community. Internally at Dover Fire and Rescue, we've made a number of changes really to help protect our members, because if our members aren't healthy, we can't be there to serve the city. So we have taken a lot of the precautions that get pushed out to the community very seriously within our own community at Fire and Rescue. That being, we're doing the best we can to keep ourselves just isolated from one another whenever possible. It's a difficult thing to do because obviously we're used to working together as a team, and we do everything in minimum groups of 2 and many times in groups greater than that. But around the station and in our daily activities, we've really limited any interaction between the 3 stations that Dover Fire and Rescue has within the city of Dover. So minimal movement between folks between each stations. We've moved to our training. We're in the middle of transitioning to a teleconferencing component where training can occur at each of the 3 stations but not have to bring all the members together. And the whole effort is to really appreciate that social distancing aspect, so that if one member does become sick, whether it's because of a call or because of something outside of work, it doesn't affect the entire workforce and then make it very difficult for us to staff the way that we need to staff to handle the calls within the city. So we have changed just the way that we configure ourselves as an organization. We've minimized the number of non-emergency contacts we're having in the community. Typically, we pride ourselves in being out there and being available, doing a lot of activities that are not necessarily emergency calls, but we're there for the public in that sense. But we've had to minimize some of that stuff now because obviously it's just non-emergency contact is just something that we're trying to avoid. But ultimately, to our conversation earlier about the PPE and the work that we've been doing to keep ourselves prepared, I just want the city to be sure that we are there currently now, fully staffed and able to handle any emergency, be it medical, fire, a motor vehicle accident, or anything to that respect. We're fully prepared to continue handling those, and we expect to do so going forward. We might look a little different in cases. We'll see us wearing masks on just about all the calls that we go on, and if it's a call that indicates a positive COVID-19 potential, will be an even greater amount of PPE, face shield, possibly gowns, gloves, and some of those things. So we may look a little bit different, but that's to protect our members from potentially catching the virus, and also to protect generally all the folks around us as well. So just reinforcing that message that we've taken the steps to keep us safe with the intention of being there when the community needs us. The city employs what we refer to as the Emergency Operations Center, and it has a number of different statuses that it could remain in, and based on what the emergency might be. If there's a weather event or something that's a short-term duration, acute event, we might staff the EOC with representatives from police, fire, maybe community services as we deal with multiple calls. for an event like this one's really unique. And across the country, emergency operations centers are finding that it's a difficult challenge to what their normal operational plan was, where this long-scale event that doesn't necessarily affect infrastructure, buildings, or utilities, but it affects people and our ability to staff our operations. And so our Emergency Operations Center has been staffed. We're in what we call a partial monitoring mode of operation, where all of our members are reporting in, we're keeping track of our resources, we're looking to see what it is we can do to plan for what the city might need and to make sure that those resources are in place. And then we have our situational awareness, which just kind of tracks the status of our hospitals, of our nursing homes, of our local resources like our grocery stores and our hardware stores and some of those things, just to make sure that we don't get surprised by a sudden shortage, or if we have a need of something and didn't realize that those supply lines were not available, or that maybe there was a nursing facility or somewhere in town that had a need that we had not been aware of. We don't want to get surprised by that. So we reach out to those folks continuously, and that's one of the roles of our Emergency Operations Center, is to just reach out to the community and anticipate what those needs are and make sure that we're planning ahead of time so that we can meet them if they arise. We take a lot of guidance from the state EOC. Their own Emergency Operations Center is staffed, coincidentally, with Dover's former Fire Chief Perry Plummer is one of the lead roles up there. But Perry's team with the Fire Marshal Paul Parisi and Jen Harper, who runs Homeland Security, they have a team there that really does nothing but gather information and push it out to our local emergency responders. And they've been doing a great job, and we have essentially been able to base most of our actions just solely on the recommendations that come out of the state EOC. Their guidance is in turn driven by the CDC on some things at that level. So it gets fed down to the state EOC through Health and Human Services, and we ultimately make the majority of our decisions based on that guidance. We do make some local decisions, just essentially based on what's going on specific to Dover or to maybe to our closer region. I speak to folks at Wentworth Douglas Hospital on a daily basis. They've been a great partner for us in this because we basically work together when we talk about the healthcare and the general well-being of our community. So Wentworth Douglas Hospital and their team, they have their hospital network that they receive information from. So we're really able to recognize the benefits of that as well because we have such a good relationship with them. So we see their emergency staff on a daily basis in and out of the hospital as we transport patients. We've got a great working relationship there. But the key thing is that we're sharing all that information. So whether it's from the state, whether it's from Wentworth Douglas Hospital, I speak daily with fire chiefs and emergency management directors in Portsmouth, in Rochester, our surrounding communities, and we just all have a good handle on what's going on around us, what other folks are doing, what they're seeing, and how we can adjust our own response in our community to fit what's happening here best. People should be aware of, especially with social media, really has the ability to bring issues and concerns that are not specific to our local area and make them feel like they're happening in our own living room. So that's really a good thing for people to be aware of. It gives us an awareness, and it certainly raises our level of concern to some areas and tells us what we should pay attention to. But we try to keep a good eye on what's going on locally, regionally, to the extent of our state and around there. And to that end, to answer your question, Dover is, so we're doing pretty well. Like we expect to see COVID-19 cases, and we're seeing them. We expect those cases to increase, and they are, but they're not doing it in what I would call an alarming rate. So the plans that have been put in place and the preparations that have occurred both internally at Dover Fire, in our police department, in our community service response team, paired up with Wentworth Douglas Hospital and our other partner hospitals and their ability to receive a surge of patients, we're not seeing numbers now that would exceed that level of planning for us. So that's a really optimistic thing to be aware of. It's not that the virus is not here, it is, and it will continue to be here and the numbers will continue to grow. But through our planning, we want to be able to absorb that surge and not have it overwhelm our resources. So again, we don't know exactly what the future looks like, but by taking survey of what is happening around us, we do feel like we have an educated assumption of how it might reach Dover and through our local areas, and we feel that our planning is doing okay. So our numbers in Dover, we certainly have COVID-19 cases within the city, and Every day we maybe get a few more, but we also have a few people that recover. So again, those numbers they're doing what we anticipated they would do, but they're not doing it at an alarming rate yet based on the preparations that we've made. So I think that one of the things that has our community in a relatively good place in our ability to handle what is being termed as a surge in cases over the next few weeks is the steps that the governor has taken over the last 3 weeks or so, and that we have taken locally as well. And by that I mean the closing of non-essential businesses, the transition of schools to remote learning, the stressing of minimal groups, no greater than 10 or more in group activity and so forth. There's always debate as to whether that was done too soon or whether it was done too late, but I truly believe overall that those steps were done at a good time to allow the community to weather this storm that we're in right now. But the important thing is to continue to weather it. So I think it's done a good job at flattening the curve so that we don't have a sudden surge in cases all at the same time. But I think if we had done it too soon, we would have simply just had people who got sick of being cooped up inside and they started venturing out, whether it was a good idea or not. So we're in that point right now where people really need to be diligent and not let their guard down. So my suggestion to folks is to simply maintain the good steps that they have been taking by staying home whenever possible, only going out for those essentials when they need them, and then remembering that social distancing, the physical distancing of 6 feet, and the frequent hygiene. Not that we shouldn't always be washing our hands, but just those constant steps and those constant reminders, they tend to get old after a little while of not being able to go outside and see your friends. But we're not out of the woods yet, so that's an important thing to remember, and I think that we have made a lot of work to get us in a position now where we're doing okay. We don't want to throw that out the window by letting our guard down. So that's the most crucial message right now is, to make an analogy, we can't even really see the goal line yet, so we're not sure exactly when this is going to end. We're optimistic that we will get there soon, but we're really not quite there yet, so we have to maintain that diligence. One of the broader resources that's available is the state's 211 information line. So that's a number that folks can call if they just have general questions and just need some of those really upper level things answered. So 211 is a good place to go for there. And to that end, if folks have health questions, like if they're not feeling well and they're wondering if maybe they have the virus or what they should do, I want to remind people to first pick up, if it's not a life-threatening condition, if they don't have severe difficulty breathing or something to that effect, we want them to pick up the phone and call their healthcare provider first before calling 911 if it's not a medical emergency, or by just going to the emergency room for something like that, because they're really trying to protect their staff and the sick patients who are in the hospital or maybe do or don't have COVID-19. So trying to get people to pick up the phone and call for that assistance first to find out what that next step should be. Locally within Dover, we've recently established the Dover Cares initiative, which provides assistance for both individual citizens and our businesses in ways, anything from rental assistance, utility payments, any of those daily aspects that might be difficult to meet now because a lot of people are out of work, to businesses who are seeing obviously an extreme shortfall in traffic to their businesses if they've even been able to remain open. So Dover Cares is a collection point where all the resources that have been brought down to us from the federal government, the state government, and our local city government resources are available through the Dover Cares initiative, which can be found on our city website. It's the quickest way to get to that. Yeah, so I want to remind folks that we have a lot of people who essentially, elderly and maybe people with underlying health conditions are the ones who have really been warned to keep themselves self-isolated at home. So if you have neighbors who might fall into either of those categories, it would just be nice to reach out to them over the phone, but just touch base and see that they have everything that they need, and maybe if they need someone to go pick up some groceries or some of those essential items, and just do something like that, because a lot of people are really proud and they don't want to ask for assistance if it's not something that they normally would have to do. So maybe offer things like that, groceries and any of those items, and pick them up, just drop them at the door, and not have to have necessarily a lot of personal interaction, but just a good way to look out for the folks around us and make sure that everyone can get through this.